You might think that bloating after dinner, a little heartburn in the evening, or a skip bowel movement here and there are just normal parts of getting older. But what if I told you they're not always normal? As we age, yes, the body changes. But many of the digestive symptoms that people over 60 experience aren't just aging, they're warning signs, signals that something deeper might be happening inside your gut. And here's the catch. Those small discomforts you brush off, they could be the early whispers of a bigger problem, one that's easier to fix now than later. So before you accept daily indigestion as your new normal, let's take a closer look, because the truth is, some changes in digestion are expected with age, but others are your body's way of waving a red flag. This is Top 10 Health Warnings, and today we're breaking down how aging affects your digestive system, from gum to bum, and everything in between. We'll also talk about what's normal, what's not, and what you should do about it, so you can stop guessing and start feeling better. Ready? Let's begin. Let's start with something we don't talk about enough. Your digestive system, just like your joints, your memory or your eyesight, ages. But unlike wrinkles or gray hair, these changes are invisible. They show up as little annoyances, feeling full too quickly, mild nausea, occasional bloating, constipation that lasts longer than it used to. And the older we get, the more common these issues become. Why? Because aging affects every part of the digestive tract. The muscles that move food along your gut, they can weaken. The production of digestive enzymes and stomach acid, it often slows down. Your gut lining, it becomes more delicate, more sensitive, and sometimes less able to absorb nutrients. A review published in the Journal of Neurogastroenterology and Motility explains that age-related changes in digestion start with the mouth and don't stop until the colon. Muscle coordination declines. Saliva production drops. The stomach empties more slowly. Even the nerves that control digestion, yes, they age too. One study from the National Institutes of Health even showed that the physical structure of the gut changes in older adults. There's thinning of the intestinal walls, reduced blood flow, and decreased gut motility. So instead of thinking, I guess this is just part of being old, we should be asking, what exactly is changing in my body, and what can I do about it? Because when you understand the why, you can find a better how. Instead of guessing, you gain clarity. Instead of tolerating discomfort, you can take action. And instead of reacting to symptoms, you can start preventing them. That's what Top 10 Health Warnings is here to help you do. In the next section, we'll walk through each part of your digestive tract and explore the most common issues that come with aging, starting at the very top. Let's begin where digestion begins, your mouth. As we age, something as simple as chewing and swallowing can become surprisingly complicated. Have you noticed dry mouth? Or that food sometimes feels like it gets stuck going down? That's not your imagination. Older adults often produce less saliva. Your jaw muscles can weaken, especially if you've had dental issues or wear dentures. And the coordination of swallowing, yes, it's controlled by nerves and muscles, can slow down or become disrupted. This condition is called dysphagia, and it affects up to 15% of adults over 60. It's not just uncomfortable, it can be dangerous, because poor swallowing can lead to choking, malnutrition, and even aspiration pneumonia. But you can help your body along. Eat slowly, chew thoroughly, stay upright while eating. And if you wear dentures, make sure they fit properly. Now let's move a little lower, to your esophagus. Many older adults experience heartburn more often with age. That burning sensation behind the breastbone, that's acid reflux, also known as GERD, gastroesophageal reflux disease. Here's what's happening. The muscle valve between your esophagus and your stomach, called the lower esophageal sphincter, starts to weaken. And when it doesn't close properly, stomach acid can splash back up where it doesn't belong. This not only causes discomfort, but can also lead to inflammation, ulcers, and scarring of the esophagus. And GERD symptoms don't stop at heartburn. You might notice a persistent sore throat, a chronic cough, a bitter taste in your mouth, or even bad breath that won't go away. But here's the good news. You're not powerless. Instead of ignoring the burn or reaching for antacids every night, talk to your doctor. Simple changes like avoiding late-night meals, quitting smoking, adjusting your sleep position, and yes, certain medications can make a real difference. Remember, what feels mild today could become something serious later. Coming up, we'll take a closer look at the stomach, especially that uncomfortable bloating after meals. Now let's talk about one of the most frustrating symptoms people over 60 report: bloating. You feel fine most of the day, maybe even after your first two meals. Then you eat dinner, something simple, maybe a boiled egg, a few veggies, and suddenly your stomach feels swollen, tight, uncomfortable. Why does this happen? Most people assume it's because they have too much stomach acid. But for many older adults, the real problem is the opposite: not enough acid. Yes, you heard that right. As we age, our stomach produces less hydrochloric acid. This acid is crucial. It helps digest protein, absorb nutrients like B12, and kill harmful bacteria. When acid levels drop, food isn't broken down properly. That leads to fermentation in the gut, gas buildup, and, you guessed it, bloating. Another piece of the puzzle: digestive enzymes. These are like chemical scissors that break your food into absorbable pieces. But over time, your body might produce fewer enzymes or produce them too slowly to keep up. So even if you're eating healthy, your body might not be processing your food the way it used to. And then there's the gut microbiome, the community of bacteria living inside your intestines. According to a 2022 study in Nature Reviews, the diversity and balance of gut bacteria changes as we age. Less of the good guys, more of the ones that cause inflammation, gas, and discomfort. That's why probiotic supplements have become so popular. But here's the thing: probiotics are not a magic bullet. If your gut lining is inflamed or compromised, adding more bacteria, good or bad, can sometimes make things worse. In a recent study from BMC Geriatrics, researchers found that even light activity or food intake can temporarily stress the intestinal lining in older adults. So what can you do? Start by tracking when bloating happens. Notice which foods make it worse. And instead of just adding supplements, talk to your doctor about testing stomach acid levels or trying a digestive enzyme. Sometimes a small adjustment makes a big difference. Up next, we're looking at something millions of older adults rely on: NSAIDs, and why they might be hurting your gut more than helping your joints. If you're like many older adults, you probably have a bottle of ibuprofen, naproxen, or aspirin in your medicine cabinet. These drugs, known as NSAIDs or non-steroidal anti-inflammatory drugs, are go-to solutions for joint pain, arthritis, and everyday aches. And for good reason. They're effective, they're non-narcotic, and they help you stay active without making you feel foggy or out of control. But there's a trade-off, especially as you get older. And NSAIDs don't just block pain, they also block the body's ability to protect the stomach and intestines. That's because they interfere with a group of chemicals that maintain the protective lining of your gut. Without that lining, acid and digestive juices can eat away at your stomach wall, leading to ulcers, internal bleeding, and even dangerous perforations. In fact, studies show that people over 65 who regularly take NSAIDs are at a much higher risk for gastrointestinal damage. The risk is even higher if you've had previous ulcers, take steroids, or combine different NSAIDs. But here's what most people don't realize. There are safer ways to use these medications. Some NSAIDs are less irritating to the stomach. You can reduce your dosage or alternate with acetaminophen. In pairing your NSAID with a proton pump inhibitor, a medication that reduces stomach acid, can help protect your gut lining. Pain relief shouldn't come at the cost of digestive health. So if you're taking NSAIDs regularly, bring it up with your doctor. A simple change might prevent a serious complication. Next, we'll talk about what happens on the other end of digestion, bowel habits, and how to tell what's truly normal. Let's talk about something no one likes to discuss, but everyone deals with: your bowel habits. As you get older, they can change. Maybe you're going less often, maybe more. Maybe your stool is loose and urgent, or maybe it's hard, dry, and painful to pass. So, what's normal? According to the Bristol stool chart, healthy bowel movements are smooth, soft, and easy to pass, like a ripe banana. Normal frequency can be anywhere from 3 times a day to 3 times a week. The key is consistency and comfort. If you're going more than 3 times a day with loose or watery stool, that's considered diarrhea. If you're going less than 3 times a week and your stool is hard or lumpy, that's constipation. Now here's the catch. Both of these become more common with age. Let's start with diarrhea. It affects roughly 7 to 14% of older adults and can be caused by many things: medications, food intolerances, irritable bowel syndrome, infections, or chronic conditions like celiac or inflammatory bowel disease. Treatment depends on the cause, but in general, soluble fiber can help absorb excess water. Loperamide may slow things down. And most importantly, persistent diarrhea lasting more than a few days should always be checked by a doctor. Now let's flip the script to constipation. Constipation affects about 23% of people aged 65 to 93. It's not just uncomfortable. It can affect your appetite, your mood, even your energy. What causes it? Low fiber, not enough water, medications, lack of movement, conditions like Parkinson's, diabetes, stroke, or even an underactive thyroid. And sometimes it's simply age. But here's something that helps almost everyone: posture. Instead of sitting upright with your feet flat on the floor, try placing your feet on a low stool and leaning forward, like you're in a slight squat. That simple change puts your pelvic muscles in a better position and makes it easier for the colon to do its job. Also, don't rush. Give yourself time and try to stay consistent with your meal, fluids, and daily movement. Because whether you're dealing with constipation or diarrhea, your bowel habits are talking to you. You just need to listen. Coming up next, we'll explore a quiet condition that affects over half of seniors and only causes problems when it flares: diverticulosis. Imagine tiny pockets forming along the wall of your colon, like little pouches ballooning out over time. That's diverticulosis. And if you're over 60, there's a good chance you already have it, whether you feel it or not. In fact, studies show that about 50% of people over 60 and up to 65% of those over 85 have diverticulosis. Most never know it's there. No pain, no symptoms, nothing to worry about until it flares up. When those small pouches become inflamed or infected, it turns into diverticulitis. Something you will notice: sudden abdominal pain, usually in the lower left side, cramping, bloating, fever, even nausea or diarrhea. And in severe cases, it can lead to bleeding or require surgery. So what causes the flare? A low-fiber diet, dehydration, and constipation are all contributing factors. When the stool builds up and pressure increases in the colon, those pockets can become irritated or blocked. The good news? You can reduce your risk. Eating enough fiber, fruits, vegetables, whole grains, keeps things moving. Drinking water and staying active help even more. And if you've already been diagnosed with diverticulosis through a colonoscopy, following a high-fiber, balanced diet is your best protection. Sometimes the quietest conditions are the ones we overlook until it's too late. Coming up, we'll connect the dots between weight gain, liver health, and the rising risk of colorectal cancer. As we get older, staying active becomes harder. A sore knee, a stiff back, less energy. Before you know it, the weight starts creeping up. And that extra weight doesn't just affect your heart or joints. It affects your gut too. When physical activity drops and body fat increases, digestion slows down. The gut becomes more sluggish, more prone to constipation, and less efficient at processing fats and sugars. And the liver? It starts working overtime. Here's something most people don't realize. Alcohol affects your liver more as you age. Even if you drink the same amount, your body's ability to metabolize alcohol declines, and over time, even moderate drinking can contribute to fatty liver disease, inflammation, and scarring. Now let's talk about something more serious. Colorectal cancer. It's the third most common cancer in older adults. And while it's still relatively rare, affecting 5 to 6% of the population, the risk increases sharply after age 50. The good news? Colorectal cancer is also one of the most preventable cancers, if caught early. That's why screening is so important. Current guidelines recommend that adults between 50 and 75 get a colonoscopy every 10 years, or you can do a stool test every 2 years. And if results are abnormal, then follow up with a colonoscopy. Screening isn't just a medical checkbox. It's peace of mind. It's the difference between early treatment and late discovery. So instead of waiting for a problem, take the first step. Because when it comes to gut health after 60, the best defense is a good defense. Next, we'll bring it all together and show you how to tell the difference between normal aging and a real health warning. Here's the truth. Aging does change your digestive system. Some slowing is natural, some discomfort is expected, but that doesn't mean you should ignore your symptoms, because not everything that's common is normal. Feeling full after small meals, bloating every evening, heartburn that lingers, constipation that stretches for days. These could all be signals. Your body's way of saying, hey, something's off. The challenge is learning how to listen. That's why it's so important to track your symptoms. Ask questions and speak up when something feels wrong. Because when you wait too long or assume it's just part of aging, you miss the chance to fix things early. And here's the best part. Many of these issues are treatable, sometimes with a small shift in diet, other times with the right medication, and often with nothing more than awareness and timing. So take your gut seriously, because when your digestion works better, you feel better, clearer, lighter, more energized. Coming up next, we'll show you exactly how to take action so you can move forward with confidence. So what should you do next? Start by shifting your mindset. Don't just treat symptoms. Take a whole person approach, because your gut doesn't work in isolation. In geriatrics, there's a powerful framework called the 5 M's. Medications, mind, mobility, multi-complexity, what matters most, and they all connect back to your digestive health. Medications, are they helping or hurting your stomach lining? Mind, is stress triggering your symptoms or affecting your appetite? Mobility, are you moving enough to keep your gut active? Multi-complexity, are chronic conditions like diabetes or Parkinson's getting in the way? What matters most? Are you living in a way that supports how you want to feel? At Top 10 Health Warnings, we believe good digestion is about more than food. It's about freedom. Freedom to eat without pain, to live without worry, to enjoy your life, without thinking twice about what's going on in your gut. So here's your challenge. Schedule that colonoscopy, reevaluate your meds, talk to your doctor about that minor symptom that just won't go away. And most of all, stay curious about your health. Because at 60, 70, 80, and beyond, you deserve answers. And we're here to help you find them.